for coming to listen to my adventure. So when I was 7 years old, I came home from school with an autobiography that I had proudly completed and showed it to my mom. And on this sheet of paper, I completed the question, when I grow up, I want to be with a scientist. And even though my S's were written backwards when I wrote scientist, I knew at that young age that I wanted to do science. And I know that's a cliche that a lot of doctors or scientists can boast these days, but I can do one better. Later on in 6th grade, I dressed up as Jonas Salk for the 6th grade career fair. And so if you didn't know that Jonas Salk was the virologist who discovered the polio vaccine, don't worry because nobody else in 6th grade did either. Needless to say, I had made up my mind. I was going to be a scientist. Flash forward about 10 years. I'm now a senior in college studying the typical pre-med track, focusing on microbiology at the University of Florida. And I'm having the typical existential crisis that every college senior has. What am I going to do with the rest of my life? I knew I wanted to do science or medicine or something, but I just couldn't figure out what it was. Luckily, I was having this debate with a good friend who suggested to me, you should really check out public health, more specifically epidemiology. I think you might really like it. And so, indeed, I went down and did some investigating, and the more and more I learned about the field of epidemiology, I realized that it was what I was meant to do in the career that I'd always imagined for myself. I learned famous stories like about John Snow, the founder of modern epidemiology, and how he famously removed the pump handle from a well and stopped the cholera epidemic north of the wall. Just kidding, that was in Soho, England. Look for John Snow. And I also learned a story about the CDC EIS officers who went village to village in Africa and eradicated smallpox. And I realized that this is what I wanted to do with my life. I imagined myself investigating disease outbreaks, stopping the next pandemic by finding patient zero, and this was it. So 2 years later, I was completing a master's in public health at the same institution, and I was a week away from starting a prized internship at the local county health department in their infectious disease epidemiology section. And now the role of this department in the health department is to investigate notifiable diseases. So things like foodborne illness or vaccine preventable diseases or STDs are the things that people most often think about. So in preparation for this internship, I had gone down the list of notifiable diseases, studying each one of them, learning their symptoms, learning their treatment, and the public health response for each one of them. My greatest fear was looking like a novice on the job. And so a week into this internship, we received our first real case, a call from the local hospital that was reporting a suspected case of meningococcal disease. And meningococcal disease is caused by the bacteria Neisseria meningitidis, which is a cousin to gonorrhea. And it's a big health concern because it can cause death or illness by either severe blood infections or severe brain infections, and it's easily spread among groups of people. And it's also a threat to those that it spreads through. So it has a huge public health importance to track down all those people who have come in contact with the case, give them antibiotics to prevent the transmission and spread of this particular bacteria. So of course I was extremely excited about this. The stakes were actually raised a little bit because we found out that this was a high school athlete, and I knew that meant that the number of contacts that this person had within the first few days prior to his illness would have been numerous. So we make a plan to go to the hospital to investigate the case and interview the family of the case. And I get together my disease manual, my notebook, my list of questions I'm going to ask when we get there, and trying to get in the mindset of how we're going to track down all these individuals that he'd been in contact with during that time period before he became ill. And we get to the hospital with my mentor at the time, and we meet with our contact there, whose name was Kay. And Kay gives us a rundown that says, the onset of illness was a couple days ago. These are the symptoms. His family's up there with him right now. They're obviously very shaken up, and it's not looking too good. So the prognosis really wasn't that great. And we accompanied her up to the intensive care unit. And when I entered into the ICU, I saw a hospital bed with family surrounding a person in the bed. And there was this young, seemingly healthy athlete hooked up to a ventilator that was assisting him with breathing. And you know, once upon a time I'd worked in a long-term care facility and I was used to seeing people that were sick. But this wasn't a long-term care resident. This was somebody that was young in the prime of their lives with their whole life in front of them. I took a second and pushed those emotions back. I got in investigation mode, and we made arrangements to go meet with the family while our contact went back to her office and checked for updated laboratory results to be able to identify this as meningococcal disease for certain. So we meet with the family, and I watch in awe as my mentor compassionately and professionally goes through the list of questions, calming their concerns, answering questions that they have, and getting this list of people that their son had come in contact with within the last 48 hours or so, which was numerous. I think we had over 60 people that we had identified that we would have had to follow up on. So we give them the contact information, and we tell them we'll follow up. And we go down, we wait again for our contact Kay to come back from her office. A little bit later, she shows up, and she has a sheet of paper in her hand and a consolatory look on her face. And she says, "I'm sorry for dragging you out here, guys, but turns out it's not meningococcal disease. He actually has a blood infection caused by MRSA. He apparently got a cut on his toe playing football, and the cut became infected, and the infection spread to his blood. It's not looking good, though." So I'm shaking my head, and I'm thinking, I've never heard of MRSA before. Now, I've studied this list of notifiable diseases, but I know this isn't one of them. I kind of just nod my head, though, again, don't want to be a novice the first day on a real case. And we're leaving the intensive care unit, and I take one last look at the room and just can't imagine how a simple infection could take somebody this healthy and within a couple of days put them into this condition, so ill and sick, again, with their family surrounding them. And just always remembered that particular image. So we get to the health department, and I go to the computer and open the search bar, and I'm looking for MRSA and every permutation of the word to no avail. And later on that day, we have a call from the hospital that gives us the news that we weren't looking forward to. That young boy had died because of the infection. And now, of course, I know several years later that MRSA, or MRSA, is the acronym for methicillin-resistant Staphylococcus aureus. And this boy was one of the 3,000 hospitalizations and 12,000 deaths that are caused by this antibiotic-resistant pathogen. And this was well before MRSA ever got deemed the first superbug. And so this story always stuck with me. I always imagined the family and that young boy. And several years later, after that first occurrence with MRSA, I was working at the health department later after I was doing a fellowship with the Florida Department of Health. And I came in contact with this organism again. I was investigating an outbreak in a neonatal intensive care unit among a number of infants. And during that experience, I met a group of investigators from the University of Florida who were applying this new great technology called whole genome sequencing. And what they were able to do is take the bacteria's DNA, the building blocks of all living things, and be able to basically make family trees of them. And using these family trees, you can understand transmission and spread, and understand, for instance, how this bacteria spreads in a hospital or in the community, or between the hospital and the community. And I just saw this as the next greatest thing, the next advance of being able to tackle this horrible pathogen. And I was so intrigued that I made the decision to go back to school and pursue a PhD to be able to learn this tool and apply it to investigating Staph aureus and other pathogenic bacteria like it. And my dissertation work actually focused on that particular outbreak in the neonatal intensive care unit using whole genome sequencing. And the results from that study were able to change the way that particular hospital prevented infections in their intensive care unit. And thinking back to that, today I currently work on Staph aureus and other pathogenic bacteria that are resistant to antibiotics, for instance. And I always think of that story and that young boy. You see, as an epidemiologist, we count things. We count cases of this and causes of that. And over time, those numbers become aggregated into larger numbers that we then analyze. And it's really easy with those aggregated data to lose track of the individual. But I think back to that boy, and he provides for me a face and a name, a story, and a family that keeps me grounded in my research And I realize now that he instilled, set me on this particular path and instilled a purpose in me that he'll never know. And today I ask myself, every time I do a study or start on a new project, how the results of that particular project will help people like him to prevent infections and save lives. Because that's essentially what public health and epidemiologists do. Thank you.